As I mentioned at the beginning, our topic today is on natural killer cells. Very trending topic right now, especially with Patrick Soon-Shiong is his
I
name,
think
with
this is
what
it.
he's
Yeah.
doing, and we do something very similar. Dr. Contreras will explain later on right now, and we're going to also talk about medical reinsurance and great topics. Great topics. Then we'll get to your Q&A.
Yeah.
So just to start off, I'm gonna play about a 2-minute video on the natural killer cell immunotherapy that we have available here at Oasis via our IMPACT program, which is our immune personalized autologous cell therapy. That is an umbrella. It's an umbrella treatment with different kinds of cell therapy, and this is one of them. And give me a quick second, and I will get that going. If you have any technical difficulties, let me know through the chat, and I'll be happy um, to modify. So let's see where it is.
Natural killer or NK cell therapy is a key component of the IMPACT immunotherapy program at Oasis of Hope. NK cells are a vital part of the immune system, the body's first line of defense against threats like viruses, infected cells, and cancer. Unlike other immune cells, such as T cells, NK cells don't need prior exposure to a specific threat to take action. They can respond quickly and broadly, making them especially valuable in cancer treatment. NK cells recognize when something is wrong by scanning for signals on the surface of cells. Healthy cells display certain self-markers that tell the immune system not to attack. Cancer cells often lose these markers or express abnormal patterns. When NK cells detect these changes, they launch a direct attack, destroying the abnormal cells. This built-in ability to target a wide range of cancer cells without harming healthy tissue makes NK cell therapy a powerful and natural way to support your immune system in the fight against cancer. Step by step, how NK cell therapy works. Step 1, collection. A small sample of your blood is drawn to isolate your natural killer cells. Step 2, activation. In our laboratory, your NK cells are exposed to immune activating proteins called cytokines. These signals stimulate the cells to become more aggressive and precise in targeting cancer. We multiply the number of NK cells from thousands to millions. Step 3, personalization. Your activated NK cells are further trained to recognize specific markers found on your tumor cells, increasing their ability to target cancer while sparing healthy tissue. Step 4, reinfusion. The activated NK cells are returned to your body through a simple infusion, where they immediately begin patrolling and attacking cancer cells. Step 5, integration. NK cell therapy is often combined with other treatments in your metabolic protocol, creating a personalized, multifaceted immune response designed to maximize therapeutic impact. With natural killer cell therapy, we are equipping your immune system to do what it was made to do: recognize, reach, and eliminate cancer cells.
With the natural killer cell therapy, we are equipping our patient's immune system to recognize the tumor so that it can be destroyed in a very natural and powerful way.
So we're gonna start off with Dr. Contreras, kind of broadening out the topic, and then we'll let Danny take over for a couple of minutes, and then get to everybody's favorite part, to be honest, Q&A. If you want to go ahead and begin asking your questions, that's always recommended, and we'll try to get to all your questions. So, Dr. Contreras, thank you for being here, and take it away.
Well, fighting cancer through the immune system is the most natural and most effective way of achieving good results. And as the video said, NKs are part of the immune system. Which part? It's called the innate immune system. So we have two major parts of the immune system: is the innate and the adaptive. So the innate can adapt to the environment depending on where you are born. For instance, if you're born in the Sahara, or if you're born in New York, your immune system will adapt to that environment. And so the natural killer cells are designed to attack virtually just cancer cells, but it can also attack viruses or dead cells to get rid of dead cells. And they are activated by cytokines. And as the video mentioned, it does not have to wait for the dendritic cell to attack the cancer. It can do it just by detecting that the cancer does not belong there. But the dendritic cell can also produce some cytokines to attack the tumor. But we activate the dendritic cells in the laboratory with interleukins, which are those cytokines. And there is a third element or a third different part of the immune system that was developed by a Dr. Ralph Steinman. He's the one that discovered the dendritic cells and how the adaptive immune system works. And so he built what is called the adoptive, where we make our immune system adopt something. So it's a therapeutical way of stimulating the anti-tumor attack from the immune system. And so in the lab, we can manipulate the cells to make them more efficient into fighting cancer, because cancers shield themselves from the immune system, and the immune system actually becomes blind to the malignant cells. And so this impact protocol, based on the work of Steinman, is producing adoptive therapies to fight the cancer. And one of those cytokines is interleukins, as I said. And so Dr. Soon has developed a very special type of IL-15, which is one of the cytokines, but that it's apparently more effective in stimulating the cells. Now this, and it's called Anktiva. It is not available in Mexico yet, but we are going to be able to import it for research, a research project. And in the lab, we can apply it to a patient's cell. So very soon, we're going to also be activating NKs with this new type of interleukin that apparently is more effective than the ones that we have available. And we're excited about that. So that is what the NKs are, and they're very, very aggressive against cancer when they're properly activated. In our laboratory, we can do that. Not many laboratories in the world have this capability, but I'm proud to say that our team is able to expand natural killer cells and then activate them very aggressively to fight specifically malignant cells and nothing else. So it's a very safe and effective type of treatment.
Thank you so much, Dr. Contreras. I have a quick question before we get to Danny. Why now? Why are natural killer cells, why is it kind of like the future of cancer treatment? Why hasn't it been studied before? Why was chemo, radiation, or surgery always the first line of the defense? And right now, why are we looking at the immune system to be able to be
It
there?
is so unfortunate, Dr. Soon developed, not Dr. Soon, Dr. Steinman developed or discovered the dendritic cells in 73.
73.
And he was awarded a Nobel Prize for the development of the dendritic cell vaccine in 2011. And yet in America, it's only available through clinical trials.
Yeah.
Whereas here in Mexico, for the last 15 years, it has been approved for the use in cancer patients. And so for the longest time, the research was on from the outside destroying the immune system and not taking advantage of the immune system, because it's logical to a point. The immune system failed, and that's why the tumor grew.
Exactly. Okay.
And so they were not looking into the immune system. But my father, since the 60s, thought that the main thing to work with was the immune system. And he started with very simple things at that time because that was the only thing that was available, is the emotional stimulation of the immune system through prayer, through laughter, through the meditation, in many other simplistic ways
Yeah.
of stimulating the immune system. And then in the early 2000s, we knew that the what was activating the natural killer cells were interleukins. So a couple of treatments for cancer were developed with interleukins, but they were terribly toxic
I remember we did
and
IL-2 a while back.
and the
Yeah.
patients
A while
didn't
back.
tolerate it, so that was
Yeah.
stopped. So thank God for the research from Dr. Steinman that has opened the doors for all of the treatments that we have available now
Amazing.
in impact, and natural killer cells is one of them. Now, natural killer cells are a little bit more complicated to expand to clone, quote unquote, than other immune system cells like monocytes that are then converted into dendritic cells. And so it takes a much longer time, but we have a protocol where we can achieve this process in about 10 days, maximum 15 days, so that our patients don't have to stay longer here. So as soon as the patient gets here, we harvest the blood, we draw the blood, harvest the NKs, and expand them for 10, 12 days while they're here. And then at the end of their therapy, they receive the NKs. We're very excited. We've been having very good results since we started doing that. Well, even before the
Yeah.
NKs, we're having good results, but in complicated patients or where the tumor is much more aggressive, then we do the NKs.
Sounds good.
We're doing more because more and more patients are aware of them, especially because of the work of Dr. Soon. And so they are requesting
Yeah.
the NKs from the beginning.
Yeah. Because we usually did them on
We
phone. Yeah.
exactly we like to offer them or offer them before only when the dendritic cells in the lacs were not sufficient. But since a lot of patients have heard about it, well, they want the NKs from the beginning, and there's
It
no
doesn't hurt.
harm. There's
Doesn't
no
hurt.
harm in doing that.
Yes. And they're specialized for cancer.
Yes, they're
It's
very
yeah.
specialized.
So more and more new patients that come to Oasis are recommended NK cells along with the dendritic and the LAC, the lymphokine activated killer cells. So thank you for that.
In
I appreciate
natural
it.
killer cells
Are
are
part
part
of
of the lax, but in a much smaller amount because, as I mentioned before, it's a lot more complicated to expand
so
than the other lymphocytes.
all natural killer cells are LACs. Not all LACs are not natural killer cells.
Okay, so
Yeah.
lax have four types of
Okay.
killer cells.
Okay.
One of them is
The
natural killer
which
cells,
is the
which is the
the
most
most important
aggressive.
aggressive.
Okay.
Okay, got it. Got it. All right, Danny, it's your turn. I want to introduce Daniel Lynch, the medical bill guru in this case, medical insurance reimbursement. We love him because he helps our patients. And take it away, Danny.
Yeah, it's a pleasure to be here as always, be back in Tijuana with the family. And I can't tell you the energy I felt this. I've been here for a couple weeks now, treating and doing some IVs myself. And it is such a energy when you come to Oasis that the feeling of just being in that IV room has been magical. So I thank you guys for sharing that with me. And it's such a pleasure to work with your patients to help them get reimbursed. Because when it comes to insurance reimbursement, that's one of the biggest questions you guys get asked is, do you take insurance? And unfortunately, in the world of integrative medicine, holistic medicine, the insurance companies are never going to be in network. They're never going to pre-approve things, which is where medical bill gurus comes in, is that we help patients navigate the system on the out-of-network reimbursement process of what is billable and not billable. Can we bill out natural killer cells? Probably not going to be able to bill out that line item, but what are the auxiliary services that are associated with that, such as the IV administration, the doctor consult, the facility fees? And that when it comes to helping patients get reimbursed, we've seen mixed results, but recently we've had great success with some of your patients in getting them reimbursed as long as they have elective international coverage. And I was speaking to one of your patients in the IV room today, and she said, well, I have insurance that I think would cover it. Well, it would cover emergency international, but not elective. And that is why it's so important that if you're interested in coming to Oasis of Hope, call my team at medicalbillgurus.com, sign up for a free consultation, and let us check your benefits. Let us determine, do you have out-of-network coverage? Do you have the ability to go and maybe get reimbursed if you choose Oasis of Hope? And that if you are looking to make a decision, we can actually potentially help guide you on what you should change your insurance to. That it is so important that you look at your policy today and take action. Most people assume they don't have coverage. This is not an option. Well, guess what? If you take action today, you can maybe go to your employer and ask for a qualifying life event to have your own open enrollment period. Change your policy to have the lowest deductible possible with the most coverage for out of network. And then my team will take your coverage and we will take the bills that we get and identify what is and isn't billable. And will be 100% transparent about expectations, that nothing is guaranteed, but we have seen everything from 0 to 100% in reimbursement, depending on what type of insurance you have. Some carriers pay significantly more for international coverage as well as holistic integrative. We've also seen some programs, such as Samaritan Ministries, cover almost 100%, if not 100%, a majority of the time. So it is worth your time and effort to look at what does your policy provide for you. And if you don't have the right coverage, how can you get ahead of that today to seek that coverage, to talk with your employer, go to the marketplace and see what your options are? And what I can tell you is that if you work for a labor union, a large Fortune 500 company, a tech company, those policies typically have better chances of reimbursement. But until you look at that coverage and have my team verify your benefits, you won't know. And it is so important that when you're making such a critical decision, that if we can help you get money back, we want to be here to help you do that.
Thank you. Thank you so
And
much.
you know, that's so important because the main limitation of what we can offer our
Yeah.
patients is
Is-
cost.
Yeah, exactly.
And so we were talking about why not NKs from the beginning? Well, they're more expensive because
Exactly.
they take longer. And so we try to offer the best type of patient of treatment to the patients so that it's not so complicated financially for
Yeah.
them because the patients are going to need to come several times. And it's a tremendous financial commitment that you have to
Exactly.
do for
Every dollar
something like
counts.
that. Yeah.
Dollar
Every
count.
dollar counts.
And so I'm very happy that that you have this team behind you that's an expert in these areas that many of our patients have been able to at least get a part reimbursed. Rarely 100%, but any little thing counts.
We know it all depends on the coverage. Like I said, there's some emerging programs such as Samaritan Ministries that most people aren't aware of, that they actually have a waiting period to joining. But those patients who have it, they have a very high likelihood of potentially 100% even.
Yeah.
Wow.
And that's what we've seen. But then when it comes to the private insurance companies, you are correct. We can't bill everything because we can only bill out the FDA approved services and the auxiliary services. So facility fees associated with IV administration, inpatient costs, because you have your patients stay here at the hospital. We can bill that out to the insurance because you're a full, what are you, what level of trauma are you? I mean, you guys have everything here to handle everything.
I don't know
The
what
levels, I
that
don't know,
means.
but we're a full functioning. Full functioning.
Let me
Yeah.
tell you a little story about a month ago. A patient came to us and had early stage pancreatic cancer on the tail of the pancreas. And what I recommended this patient is surgery
Yeah.
because it's an early stage and it's surgery of the removal of the tail of the pancreas is not complicated in comparison to the head of the pancreas where it's a massive surgery that I don't recommend. And I said, well, do you have insurance? He said, yes. Well, go and have it in the States. No, precisely because I have an insurance that's covered by my church.
Mm-hmm.
I want to know what your price is because I want to save money to my church because they're going to pay for everything. He mentioned the name. It was not Samaritan, but it's a network where this. I don't know if many churches get together, but it's a cooperative.
Privately funded insurance.
And
Yeah.
And so we were able to save that church or organization about $100,000
Goodness.
by doing the
It's a
surgery
significant
here.
amount.
Yes. So in those cases, you can also save money to the insurance companies that are actually paying. And I remember many, many years ago, you remember, of course, you remember Cameron Fry, but
Yeah.
in the early days, most insurance would pay.
Yeah, it's gotten significantly harder over the years. I've been doing this for 10 years now, right? And just in the time period I've been doing this, it has gotten exponentially more difficult of getting the insurance companies to reimburse because deductibles are going up, premiums are going up, coverage is going down, and the insurance companies are repricing things lower than ever.
Yeah.
And
I mean, it's
so at that time, I remember very clearly that they just loved to pay here because they were saving so much money. But then the AMA, the American Medical Association, sued them for paying
Out of country.
yeah, not FDA approved treatments. And that's what changed everything. So
yeah.
it's a shame.
Well, in the US, the question is who owns the hospital, who owns the insurance company? They all kind of work together where it's one big system. And that's where patient care goes down, where you guys are different, is that when you come to Oasis, you get how long do you spend with your first patient every single time?
Yeah.
And the level of care, but it's the same reason they want to be in network because they have control of the reimbursement rates.
Exactly.
And that's when it comes to out of network, that it's a black box, that some patients, when they go abroad, depending if they have, let's say, a Blue Cross Blue Shield or United Healthcare or an Aetna, depending on the quality of that policy, we can still get back a significant amount of money. We just got back one of your patients, I think 60, 70% of what they spend. But some patients, they may not have the right coverage, or the insurance companies may not want to pay for holistic integrated
Correct.
treatment. And honestly, from my experience of working with 150 clinics around the world, as well as all the clinics in the US, the domestic reimbursement rates are even more difficult. And we've actually had better reimbursement internationally with the majority of the clinics we work with than domestic because they
Wow.
process differently through a global claims department. I can't explain it. But that's why at Medical Bill Gurus, we actually charge a deposit for our domestic patients to take them on. But internationally, we don't charge any deposit because we're in a higher likelihood of reimbursement for all of us to win together because it's that much easier actually international as long as they have elective international coverage. It doesn't make sense. It doesn't make sense, but I stop asking questions and we just do what we can.
All right. Well, thank you so much, Danny. I appreciate that. And our patients are going to really benefit. They do benefit from you right now in your services. So we're a big, happy family, guys. Big, happy family. We treat them, you get their money back. I love it. I love it. Let's go with everybody's favorite Q&A. I'll try to pepper in a lot of the different questions. And if we get to your question, that's amazing. If we do not get to your questions, maybe it's time or it's something similar to other patients, what they ask. But let's start off with the first question for Oral, asking, I'm sorry, does dendritic cell therapy harm your liver?
Not at all. Not at all. These are your own cells that we expand them. I use the term clone. It's not cloning, but it's the term that everybody understands. When you multiply the cells, it's not called cloning because that's something that naturally happens, and the correct term is expanding them. So we harvest maybe 100,000 of these cells and then expand them to 10 million, sometimes 15 or 20 million. And that's what we put back. And these are now activated and much more aggressive against the tumor. And that's why they're so effective and very, very well tolerated. The side effects that you may have are not due to the cells because they're your own cells. They're due to the chemicals that are used in the process. But thank God, new techniques of washing out the cells and cleansing the product has brought down
prior to the administration, after it's harvested and multiplied,
has brought down the side effects virtually to zero.
Yeah, and a fever
Yeah,
or
they're flu-like
flu-like
symptoms. Yeah.
symptoms, exactly. So one thing, I mean, that's liver issues is something that we deal with a lot in potential patient admissions, and I always find that if they have liver issues, it complicates the recommendation because the metabolic therapy is so
Exactly.
taxing on the liver, right? Yeah.
Everything that you do, it's processed by the liver, right?
Mhm.
And so if the liver is up to par, well, there's no problem. But
Okay.
if you have liver insufficiency, liver dysfunction, obviously we have to be careful in what is it that we can
Yeah,
offer you,
exactly.
depending on how severe the liver function is
Yeah,
been disrupted.
and most of the patients that have liver issues, we
We
just do
will
the
we will
dendritics.
let you know if
Yeah.
we can take you or not. But let's say that you have liver insufficiency with a high count of bilirubin, which is what when the liver is extremely limited. Then the only thing usually that we can do are the cells because those are not going to tax the liver.
Mhm. All right. Sarna has a question for Danny. Have you had any experience success with Kaiser Medical Insurance for reimbursement?
Kaiser is one of the insurances that I would say is fairly difficult.
HMOs, right?
Well,
Yeah.
because Kaiser typically wants you go to a Kaiser provider. And so they have their own hospitals, right? So when they're the insurance, they usually have very limited out-of-network coverage from our experience. We've had some success domestically, but never any success internationally for Kaiser,
Okay.
unfortunately.
No worries, no worries. That's a good question, Sarna. I appreciate that. Um, NK cells for sarcomas, cold cancers.
Yes, uh, especially in those cases, we have to um, use the dendritic cell part, very significant, and the NKs. So remember, the NKs do not necessarily need information from the dendritic cells to attack the tumor. They can actually do it directly. But sarcomas are a lot more difficult to treat. So in those cases, we absolutely need the combination of signaling
Okay.
to attack the tumor from the dendritic cells and cells and on their own. So we usually do that combination at any
Either
rate,
which way, right? Yeah.
but especially in sarcomas, we have to make sure that we're offering both.
Got it. Got it. Got it. Let me see. It's a question for both. Two-tiered question. What success have you had with triple negative breast cancer? And have you had any success with HealthNet PPO? HealthNet PPO. So I'll let you guys decide who wants to
Yes,
answer
we've
first.
had very good success against triple negative breast carcinomas. They're usually more aggressive, more difficult to treat because they do not respond well to chemotherapy or radiation therapy. The best option is to find it very early, and surgery can be quite effective, but the recurrence rate is very high, even with early stages treated with surgery and our response to triple negatives is almost the same as with normal
Yeah.
ductal breast carcinoma. So
And we're getting
we're
a lot of
very
triple negative breast cancer. It's
for that reason
yeah,
because
exactly.
the patients let everybody
Yeah,
know.
they have good
So our
results.
results with triple negative breast carcinomas, even in very advanced stages, are very, very encouraging.
When it comes to HealthNet PPO, I just did a quick Google search on my phone to confirm because that's not a common insurance company that I've heard of, but they're based out of California because I've heard of us doing some limited billing with them in the US. But that's one of those policies where for me to accurately answer that, I need to see if you even have out of network coverage. I would say that that's not going to be a top tier reimbursement candidate, most likely, just being very frank and honest. But my team could take a look at your policy and check that level of coverage. Is that if it's through the marketplace, typically the marketplaces have less chance of very worthwhile reimbursement because they typically have a higher deductible and lower reimbursement of the usual and customary rate. So for HealthNet PPO, I'd recommend sign up on our website, medicalbillgurus.com, and let me get one of my team members to take a look at your benefits and check to see what we think.
Thank you, Danny. I appreciate that. Robert is asking, I have stage 3 plus HCC cancer. HSS, HCC, so that'd be
Oh, hepatocellular carcinoma,
carcinoma.
HCC.
What if I had immunotherapy with no results? Would this be different type of cancer? Imagine conventional immunotherapy. That's all.
Yeah.
Yeah.
In fact, when we're able to combine conventional immunotherapy, if let's say that you're a candidate, you have to have a certain mutation for certain types of, there are several types of immunotherapy. The most common is the PD-1, and when you have that mutation, then you're a good candidate for Keytruda.
Yeah.
That's one of the
Very
most common. There are several. Um, and when we can combine a checkpoint inhibitor with our therapy, the results are better. Hepatocellular carcinomas are very aggressive. And so if you can do the combination, it would be very good. We have treated a number of hepatocellular carcinomas very effectively with our combination of our metabolic therapy and immune therapy. And if you have not had success, with conventional therapies, I would encourage you to come. And if you have been offered the immunotherapy without the chemo, then the combination with our therapy would be very, very good for you. If you're receiving chemo and we give you our cells are live cells that are virtually going to be destroyed by the chemotherapy. So if your doctors are not offering chemotherapy, which is very possible because chemotherapy has not proven to be of any help to patients with hepatocellular carcinomas, then please come and do the combination. Your possibilities of response are going to significantly improve with the combination.
Thank you, Dr. Contreras. And Robert, call us at 888-500-4673. Go on our website and fill out one of our contact forms. And for anybody that's attending now, whether you're a patient or a loved one, we offer free Zoom consultations with one of our attending physicians. And all you need to do is call us or go on our website and fill out one of our contact forms. All we need is some medical records, specifically the pathology report, any kind of imaging results, and lab work. And with that, we can recommend treatments and see if you're going to be a good candidate at Oasis. So give us a call, Robert. How about we got okay. So Julie is a current patient of ours. I've been to Oasis 2 times. What is the price of the NK cells? I'll go into that. Is it possible to come to Oasis Hope for blood sample collection and come back 15 days for NK application? Yes. So price of the NKs, we can go through that. We'll call our follow-up department and we can give you the price for the specific NK cells. But some patients that do come for 10, 15 days, they come, they get the blood drawn. We start the process of expanding, collective expanding the NK cells. And about 10 to 15 days afterwards, the patient comes back and we can do the treatment. So yeah, you come for the NK only, go back home or go visit Mexico and come back for the therapy.
Correct.
Is the NK applied alone or in addition to LAK dendritic vaccines? It's applied all three together. Yeah.
Exactly.
Yes.
It can be a combination, but NKs on their own are also applied.
Do we apply NKs alone or is it usually in combination?
Usually in combination.
Right. Yeah.
But so if a patient that has come several times, right, that already had the first part of the vaccination process, then we can do NKs only.
Okay.
Okay.
Got it. Pablo's asking, is a therapy effective against prostate cancer?
Yes. Our best results are in breast cancer, and the second one is prostate cancer. It's a family of tumors, and so very high Gleason score. The Gleason score goes from 6 to 10. So 9s and 10s, depending on how many treatments you've had before, the response may drop as if the patient, let's say, that was diagnosed 10 years ago and has been through multiple therapies, then it's a little bit more complicated because it's a tumor that has a lot of experience. But most of our patients with high Gleason scores have not been treated for a long time because they're a lot more aggressive. And so our treatment has been very successful, even in high scores, especially when they have not been treated before.
Perfect, perfect. We're getting a lot of questions, Danny, on only U.S. patients or international patients. I mean, a bunch of questions on those. I mean, I
Yeah.
live here, I live here.
You know, I was in your IV room today, and it was so funny. You guys have so many patients from around the world that I had
Yeah.
patients from probably every continent, I feel like, since I've been here asking me the same question. I will be honest, guys, we specialize in helping with Americans. That is our bread and butter of what our expertise is. For certain types of insurance internationally, we may be able to help. It is not our forte, but we can take a look at things. I would say look at your policy and see if it does have elective international coverage. We've had some international Aetnas that we've helped with patients who work for, let's say, I had a patient who worked for NYU University in Tokyo, and we were able to bill their insurance because it was actually an international policy, but it applied everywhere around the world. So for international patients, talk to us on a case by case basis. It's not our forte. It's not something that we do a majority of the time, but in certain instances, we have had some success.
Thank you so much. Thank you very much. I'm getting a lot of questions. I'm gonna lump this together because it is a recurring theme in the questions about how many times the patient has to come back after the first treatment. So can we go into a little bit
Yes,
of that?
yes.
Yeah.
So every patient is different. We have to first evaluate the response to the first treatment. And usually, depending on the aggressivity of the tumor, we will give the therapy and evaluate in 3 months. And depending on the result, we will let the patient know if he needs to come back, he or she needs to come back in 3 months or in 6 months or in a year. Um, and there are some patients where the tumor is so aggressive that we are doing every month.
Every month, yeah.
Okay. So it will depend on a case by case basis. But as a general rule, the patient is expected to return several times.
Okay.
I've heard patients that, I thought that I was just going to come once and that was going to be it. And
we wish.
yes, that would be
yeah.
wonderful, but there is no therapy in
Yeah.
any part of the world where you give it once and then that's it. It's only maybe when you have an early stage, stage 1 or 0, and you remove it surgically and then that's it.
Yeah. Surgery is always
so it can happen.
Yeah,
But
exactly.
no, patients definitely, when you think about any oncological treatment, is not going to be once.
Exactly.
Yeah.
And treatment gets more personalized as patients come back every time because the response to the therapy is very important. So that's why we do PET CTs, we do lab work, we do a full workup of the patient
Yeah.
just to see how the patient is
The
responding.
evaluation is very objective.
Exactly. And that's where everything comes in. I mean, if it's something that Dr. Contreras can surgically remove, it's the second or third time of that the patient comes back, or any kind of conventional immunotherapy combined with the autologous cell therapy, or a lot of things. So all follow-up treatment protocols are as much personalized as they can. So it could be 1, 2, 3, 4. I mean, it all depends. There's no cookie cutter way around it. But
not yesterday, the day before yesterday, I saw a patient that has been coming for us for 5 years, tumor free, and usually at 5 years or 5 vaccinations per year. So let's say that a patient comes and receives and it's completely tumor free after 3 vaccinations. What we recommend is once the patient is completely stable or tumor free, to do a boost of the vaccine once a year to complete 5 years, and then we graduate them.
Keep the immune system working, right?
Yeah.
Keep the immune system working. Danny, got a question on what's the best way to contact you? Call you or email you or on website?
Sign up on our website for a free case evaluation, medicalbillgurus.com. Click contact. And what that will do is you can put your information in there, and then a member of our team will contact you, or you can call us anytime at 1-800-674-7836. We are very busy, so sometimes we try to get those form submissions so that way we can interact with emails. But you can call us or email us or sign up on our website, and then we try to get back to you within 24 to 48 hours.
Perfect. Thank you. Thank you. John's asking, is NK cell therapy effective for blood cancers? Great question, John. Great question.
More and more, we're learning how to treat circulating tumors. 2 years ago, I can tell you that we were not.
Mhm.
They were not effective at all for leukemias. But our technicians and the doctor that it's in science that it's in charge of the laboratory has now found a system or a technique to prepare dendritic cells for circulating tumors. So we're gaining experience. So if you are in remission and you want to reduce the risk of a recurrence, that's where I believe that right now this cell therapy would be very good for you. If you have an acute form of leukemia, we need to control that and get you into a remission so that the dendritic cells can be applied and be given to you. Or if you have a chronic type of leukemia, in those cases is where we are gaining more experience and where our treatment can be helpful. In acute leukemias, no, it is not the treatment of choice because it's
B cell, is it CLL, chronic
yeah,
leukemia? That's chronic, and
that's a chronic, and definitely you would be a candidate to combine whatever treatment you're doing
with our treatment.
with our treatment.
And also chronic myelomonocytic leukemia.
Yes.
Also, MML. Okay. Yeah. So Esther, that was for you. So give us a call. John, also give us a call if you have any questions. Let me see. Very specific question. My brother-in-law has non-small cell stage 4 lung cancer. He's getting a brain scan tonight and couldn't be here. He fasted 17 days and is nauseous, so he broke the fast today. Should he take ivermectin and febendazole? Is he a good case for your hospital? I'm so worried and scared for him both. Both of my parents have stage 4 cancer. They are 77. I'm so worried. I found your hospital from Rick Hill's story. Thank you, Rick. Cancer free, 50 years. Yes.
Yes,
Small cell stage 4 lung cancer.
I'm assuming that they're doing the brain MRI because they have a suspicion that he could have metastasis to the brain. Those have to be taken care of before he or is your brother, right?
Yeah. So
before he comes here,
Stacy, yeah.
So if there are brain metastases, those should be radiated. Radiation therapy to brain metastasis is very effective, usually well tolerated. And thereafter, you can come. One of the most common tumors that we treat here are non-small cell lung carcinomas. Unfortunately, there's two types mainly of lung cancers. One is the non-small cell, which is aggressive but more treatable, and the small cell. Those are extremely aggressive, and usually by the time a patient comes here is virtually too late. But we've treated those as well when they come in earlier stages or when the patient is in good condition, and we've had good reports. Non-small cell is the less aggressive of them. It's the adenocarcinoma of the lung, and we've had very good results against adenocarcinomas of the lung.
If you're self-employed, I personally have used companies such as Rippling, where you can join, I forgot what it's called, a PEO, a preferred employer organization, where then you have access to other insurance options. But the reality is, if I were to tell you, go get the best insurance, United Healthcare or Blue Cross Blue Shield, that doesn't mean that you're going to be able to go get that and that you're going to have the eligibility to even qualify. So when it comes to if you have your options, United Healthcare, Blue Cross Blue Shield, we've seen great results. UMR, we've seen great results with that at your facility. When it comes to the programs similar to Samaritan Ministries, Christian Healthcare Ministries is another one that we've seen really good results with. And then Liberty is one that's mixed or not. But what's interesting is if you were to read the guidelines of those programs, particularly Liberty, Samaritan, and Christian Healthcare, they actually state that they believe in holistic medicine in the guidelines.
Uh-huh. Oh,
So
wow.
yeah, so it's very interesting with how those programs operate, that they see the value of holistic and integrative medicine, and it's built into the policy. Because I actually spoke to the management at all those different entities at one point in time, and they do cover, in the US, I know people have gone to naturopaths and done various IVs and got it reimbursed. The question is, will they reimburse 100%, or what is the amount that they will reimburse? But I would say look at what you can actually qualify through your employer. If you own your own company, go look to see if you can join a TriNet, a Rippling. I think another one's called Bamboo, where they give you access. That's not the Obamacare marketplace, but is a private insurance marketplace for employers. And that was how I was able to get my own United Healthcare PPO plan with a handful of employees on the fly. Was doing that. So if you are self-employed, you have that option. Don't go to the marketplace. Go to one of those options and see what you can get.
Sounds great. Sounds great. And follow-up question. What does Danny need to initiate a review? What do you need to initiate a review? The policy or
Of the review of the
Yeah.
plan. So
let's talk two things, before and after. So before, if somebody wants to come to Oasis, they're like, will I get reimbursed? What do you need?
Oh yeah. So when you sign up on our website, you'll be emailed a link with our contract and our form, and that you will put all of your demographics information of your name, address, phone number, your employer, information about that plan, and then send us copies of your insurance card. And then we will actually call the insurance on your behalf with that information and verify your coverage directly from them.
Okay. Got it.
And then if they do qualify, then we work with your team to request the necessary documentation that we need. And then we handle everything from there and submit it.
Yeah, so it's very similar if it's post-treatment or pre-treatment, right?
Yeah. The sooner, the
sooner the better, right?
The benefit of why your sales team or your patient care coordinators at Oasis do such a good job is they let patients know as soon as possible that if we can get ahead of it, maybe we can guide them to get the right insurance ahead of time. And that some people have the option with their employer to have a qualifying life event and choose a different policy knowing they're going to use it.
Got it.
And that would be where you get, hey, so it's amazing how many people will save $100 a month to have a deductible that's $10,000 more.
Yeah.
And that it's insane. So if you are considering treatment at Oasis, my advice is do whatever you can right now to brute force a qualifying life event and get the lowest deductible possible. Even if your premiums go up a couple $100 a month, well, guess what? You probably are going to use your insurance more than ever right now, whether it's with Oasis or at home.
Got it.
And most people don't realize that they can get out of that situation to save thousands upon thousands of dollars. Or the worst case scenario is that people chose the HMO over the PPO and can't even do anything.
Yeah.
And if you can get out of that boxed in situation, we want you to have that PPO as much as possible.
Sounds good. Thank you. Thank you. Thank you. Let me see. What sort of success? I know we spoke about this, but success rates with triple negative breast cancer. Success rates.
Our 5-year survival rate when a patient has received treatment before is about 50%, which is 3 times more than with conventional therapy, or probably even higher. And if a patient comes virgin to treatment to us, no treatment whatsoever before, then the 5-year survival rate is about 75%. Very, very, very encouraging results.
Okay. Great.
And we're talking about stage 4.
Stage 4, yeah. All of our percentages
The studies were
on stage 4.
So obviously the results are going to be better the lower the stage.
Exactly. Let me see. In a patient with mild or moderate chronic kidney disease, is the NK process still applicable?
The NK definitely is applicable. The rest of the therapy is what is in question, depending on the insufficiency. If it's mild, and the creatinine levels, let's say, are just a little bit elevated, then we can give the whole treatment.
Okay, Charlotte, give us a call if you have any questions.
Yes.
Yeah, mild to moderate,
Yeah.
90% we can treat you. Yes, thank you for that. Um, let me see. Vicky's asking, NK therapy sounds a lot like CAR T therapy, which I'm being recommended to take. That's
Well,
good.
CAR T cells are based
On
on the natural killer cells. The beauty of the CAR T cells, and it's the biggest difference. Everything is the same. Is that CAR T cells are manipulated genetically, and this may rise some red flags. But what's genetically modified is the cell, the CAR T cells. Your cells are not going to be modified. And so the beauty of the CAR T cells is that they regenerate for a while.
okay.
So whereas the dendritic cells and the NK cells in all of our cell therapy, they have a lifespan. The CAR T cells have a very long lifespan.
Do they
Sometimes
reproduce?
even
Do they
they
reproduce?
reproduce
Okay.
themselves.
Not forever.
Not
Not
forever.
forever. Yeah.
That's why usually one treatment is required. There
Okay.
are some patients that require one, two or three, and the problem is that they're $500,000 every treatment.
That's true. Or Danny can get some
Um,
reimbursement for that.
Well,
Yeah.
that's the whole idea is that with patients coming back here, they're going to have to come back a couple times typically.
Yeah.
That if we can get some type of reimbursement every time, then we can make sure that they can keep coming back more
yes,
for more because it's this expensive with these type of therapies, and that's just
yes,
being the blunt truth. Um, and that if we can get the patients to know what insurance works for them sooner than later versus every time they come and they have the wrong insurance, then we
yeah,
can't even get in the batter's box and take a swing at the insurance.
yeah.
I was talking to some patients today in the IV room, and I'm very direct. I don't like to sugarcoat the truth, but it's always that point of like, I wish I had talked to them sooner to see if I could do something differently. So that way they could have maybe tried on this iteration to see if this was the right insurance coverage. Because you'd be surprised at what people can do if they appeal to their employer
Yeah.
about how can we change my coverage? This is my situation. And one of the situations that I didn't even talk about that just came to mind is we've had a lot of really good success if people have insurance and their employer self-funded, which means that if the employer funds not only the coverage, but paying out for any type of treatments, that if they use, let's say, a Cigna to administer it and Cigna denies it, well, then if it's self-funded, we can appeal directly to the employer and state, hey, this patient had this treatment, we need that covered. And then they overturn it because they're the ones who have to say at the end of the day to cut the check.
That's interesting. Let me just mention something about CAR T cells. We are gearing up to be able to produce CAR T cells here at the Oasis of Hope at a much lower cost. We believe that very likely the cost is going to be about $50,000 instead of $500,000. And we are banking on the fact that CAR T cells in the very short time, we're in about the third or fourth generation of CAR T cells. The original CAR T cells are not effective at all for solid tumors. They're only effective for circulating tumors. But all of the thrust of the investigation is on solid tumors.
It's funny because blood cancers have a high success rate with chemotherapy.
But if you don't have to use chemotherapy,
even better.
but $500,000
That's true.
is a complicated thing.
Yeah.
And so I am sure that very soon we're going to find that trick to be able to be successful with solid tumors. And since our experience with all our impact protocol has been so encouraging in solid tumors, I think that we're going to have an advantage when we can produce our own CAR T cells to treat solid tumors in comparison to the rest of the world.
And that's the thing about Oasis that I love. We're always innovating. We're always at the forefront of new treatments, and we see the results here clinically. So it's a great thing about coming to Oasis, and I love working here. I love working here at Contreras. It's 5, and we have to make the webinars 2 hours.
Yes,
but we're gonna do a lightning round, like 5-minute lightning round. 5-minute lightning. I know. I know he had surgery this morning, so he's a bit tired. Success rates with metastatic squamous cell nasopharyngeal carcinoma stage 4. Very specific, Ralph.
So in head and neck tumors, we have not been able to do a prospective clinical trial, so that I couldn't tell you what our prospective outcome is because we don't have it. But retrospectively, I can tell you that in about 30% of our patients with head and neck tumors, they're all clumped into one, have been very, very good. And since we have the vaccine, they've improved tremendously. I just saw a patient that came for the third time, a very large tumor. He was given a very, very poor prognosis, had radiation, chemotherapy, and now he's been tumor-free for 8 months, I think.
Praise the Lord.
And doing wonderful, and he's very, very happy. So in head and neck tumors, we're very encouraged.
Perfect. HER2 positive stage 4 with mets to lymph and liver, ELSA.
I'm assuming that it's breast cancer,
yeah, breast cancer,
because there are other tumors that can be also HER2 positive. Yes, those I think that's a typical case that we get, that patients and if you had anti-HER2 therapy,
yeah, she's getting targeted treatment now.
Okay, so Perjeta or some of those Herceptin probably. I would encourage you to continue with that, and we can combine our therapies with a targeted therapy.
Yeah, checkpoint inhibitors.
Yes.
Yeah.
But HER2 inhibitors as well.
HER2 inhibitors as well. Okay, got it. And that's one of the things that we encourage patients back home to continue treatment if it's
it can be compatible, and sometimes they synergize.
Yeah, exactly. So even surgery, if they can get through insurance and get a reimbursement with Danny here, we recommend they go back home for the surgery or any kind of conventional chemotherapy, especially conventional immunotherapy, because it can be so expensive.
Yeah.
And we can get it here, but it's out of pocket. And Danny's going to help with that.
We can't bill out certain as long as we know the drugs are being administered, we can bill out some of them.
Yes.
Yeah.
And so that's the beauty of, we try to go case by case to identify everything that we can and go after every dollar possible with what you're offering your patients. But it's sometimes a moving target because you keep adding new things. You're always innovating.
Yes.
You make it tough for us that we think we got a template.
For instance, we just started a protocol combining our therapy with checkpoint inhibitors,
yes,
where we are injecting the inhibitor directly into the tumor.
Oh, wow.
Even when a patient is not PD-1, and the results have been, we are very excited.
Yeah.
See, we have to figure out how to build that out. You have the mad scientists over here being like, we're going to do something no one's ever heard of. And then,
Yes.
But that's why you get results.
Yeah.
And not only that, we're also starting cryoablation and ablation.
Yeah. And for instance, we have many capabilities of doing things that are not available in America. We have a patient that has very limited funds and couldn't do the Keytruda directly to the tumor. So there are a number of publications where ozone directly into the tumors and around the tumors can be very effective. So this is a patient that is doing very well with us, breast cancer patient that developed one lymph node in the axilla. And so we already applied the ozone therapy because she didn't have the money for the Keytruda. It's very expensive. So I know that we're going to get very good results.
Perfect. Last question, and I want to make it a good one. Will there be a replay? Yes, there will be a replay. Tomorrow morning on YouTube, this webinar will be on replay. You can watch it, and also on our Facebook channel, Oasis of Hope Hospital. Our YouTube page is youtube.com/oasisofhopehospital.com. So just go on our website and click on the YouTube link. But the last question, let me see. I want to make it a good one. Hold on a second, okay? What's this? Yes, I mean,
no clue of what the last question.
The last question's got to be a good one
because there's so many to choose from.
Well, no, we already asked it first.
No, that was a question for me, not for you.
Reminds me of our people.
Okay,
I'm going to end with this, and then he never ends.
They say that for a prayer to be blessed, it doesn't have to be eternal, right? Yes.
Exactly.
So CP is asking, effective for, imagine saying, what is effective treatment for metastatic ovarian cancer to lymphatic nodes after radical hysterectomy?
Well, our results in ovarian, so the best results are in breast cancer, and the second one is with ovarian cancer, all types
Yes.
of ovarian cancer, and in all stages. So yes, that would be a patient that would be a good candidate for it.
Perfect. I want to thank you on behalf of Dr. Contreras and Daniel and the Oasis of Hope family. Thank you for taking time out of your day and attending our second webinar of the year. And I think the most important question is, when is our next webinar, right? So we're going to say about 2 to 3 weeks from now, you'll get an email to register and with the topic. And from Tijuana, Baja California, Mexico, to the world, we want to thank you again, and we send you our loves. If you have any questions about treatment for yourself or for a loved one, please call our 800 number, 888-500-4673. We have admissions coordinators standing by, and you can book a free consult via Zoom with our admissions physician, and all we need is some medical records, and we can give you a good idea what we can do for you, give you the price and everything. A lot of questions on pricing, and to be honest with you, we don't give it on publicly, but we do provide those through our admissions coordinator. But
And that's because
it varies. It varies. Yeah, every case is different. Every cancer is different, and everybody's situation is different. So all treatments here are very personalized, depending on the recommendation of Dr. Contreras and the staff. And I want to thank Danny for coming all the way down from Florida.
Florida man in the wild over here in
You
Mexico.
brought the rain with you.
I know, man. This weather's crazy.
Yes, it's rainy here.
I know.
And thank you so much. Have a blessed day. God bless you and each and every one of your family. Bye bye.
thank you.